Diabetes is often preventable, yet it's one of the most common diseases in the world. It's important to know diabetes can affect your eyes, even causing blindness. Dr. Mirwat Sami helps us sound the alarm and offer ways to save a diabetic's eyesight.
So you get in here and you're thinking, oh, I'm going to get my vision checked. But a doctor can tell a whole lot more in your eyes than you may realize, including an oculofacial plastic surgeon always finding surprises in people's eyes. What can you see in there sometimes?
You know, they say the eyes are the windows to the soul, and that's because they truly are. There's a whole world of diagnoses we can make just by looking inside the eyes. And since it is Diabetic Retinopathy Awareness Month, I'm so glad that you're putting a spotlight on that, because that is one of the areas. An eye exam is when we can sometimes diagnose someone with diabetic retinopathy, diabetes in their body, affecting so many different organs in their system.
What would that look like for you to be taking a look inside and see that in the eye of all places?
And so when we do a complete eye exam, we dilate the eyes, dilate the iris, and look at the back of the eye, that's the retina. And when someone has diabetes, there's some abnormal new vessels that develop there, swelling that occurs, and it's all because of poor glycemic control, elevated glucose levels in your blood. And that kind of incites this sort of inflammatory and neovascular process. These new vessels that grow can cause some damage, bleeding inside the eyes, vision loss, permanent damage, retinal detachment. We're talking about cataracts, glaucoma, a whole spectrum of conditions. And guess what? A lot of those are indicators of similar damage happening in other organs like the heart, the kidneys, all these vital organs that we need.
And that's all because the glucose gets out of control and it's not being closely monitored by somebody.
That's right. And so diabetes is when the body is resistant or is not producing enough insulin. And insulin is a hormone we need to control the level of glucose that our body and our systems are exposed to. And when we develop diabetes, that glucose level goes up, causes all this damage that over time can have a cumulative effect on all these organ systems.
What are the symptoms of retinopathy?
Blurry vision, it ranges from blurry vision to loss of vision. People will have dry eyes, infections as well, because remember, when the glucose levels are elevated, your immune system goes down. And so people are a little bit more prone to skin infections, facial infections, eyelid infections, sinus infections, and so that's how I end up seeing a lot of that in my practice, you know, treating people and just trying to figure out why is it that they're developing all these infections and their immune system is not able to basically control it.
All right, time to control that blood sugar and make sure you get to your doctor on a regular basis.
Dr. Sami says 90% of permanent eye damage can be prevented by early detection and intervention. Here are some ways you can prevent complications from diabetes like diabetic retinopathy. Maintain a healthy weight. Exercise, make healthy food choices, manage your blood pressure, manage your cholesterol levels, avoid smoking. Just do what you can to make sure you stay nice and healthy. Nate?